Monday Morning House Calls, sponsored by UK Healthcare.
Welcome back to Mountain News this morning. Today we're talking to Dr. Joe Kingery about pneumonia. So what are a few of the symptoms of pneumonia?
So it's a great question. So pneumonia typically is an infection of the lungs. So things that you look for with that are cough that's usually productive, meaning that you're actually coughing something out, as well as a fever that goes along with it. Sometimes people will have shortness of breath, sometimes they won't.
Okay, so if someone is experiencing these symptoms, and when should they go and see a doctor?
So anytime you've got a fever, you've got a cough, especially if you are coughing something up, I think it's a good idea to get checked out, because it certainly could be pneumonia. There's always a possibility that it could be something else going on too. Obviously right now, flu is starting to hit some too, and flu can cause similar symptoms, and it's important regardless of which it is, or if it's something else going on, that you get checked out and get it treated appropriately.
Okay, so what would be something that would be, a big indication that it's, pneumonia versus the flu?
Sure. So flu typically will have a higher fever. You'll have body aches all over. You'll have some sneezing, runny nose with it, whereas with pneumonia, you don't necessarily have the body aches, although you can, and then it's more of just the cough and coughing things up. One of the things also to keep in mind is that there are pneumonia vaccines out there for people in order to help prevent pneumonia, and that's very important in some of the people who have predisposing conditions. They're immunocompromised for some reason, have diabetes, or lung disease already, such as COPD.
So then I guess are those folks the ones that are most likely to get pneumonia?
Those are. Diabetes automatically puts you at risk of having different infections. Pneumonia is no exception to that. COPD, asthma, emphysema, those types of things will certainly put you at risk. And those are the people we focus on really at any age of getting a pneumonia vaccine. Typically what we look at is age, so 65 years and older, we want people to get a pneumonia vaccine. But honestly, the people who are younger than that, who have those conditions, are also supposed to get a pneumonia vaccine as well to try to help prevent pneumonia.
All right. Well, thank you so much for joining us, Dr. Kingery.
Thank you.
We'll have some more Mountain News coming up right after the break.